All right, and so as I mentioned before, welcome to Doing Business with Cook County Health. My name is Dr. McKee Butler-Finn, and I am with Cook County Government Office of Contract Compliance. And today we have Jacoby Rafford and Mr. Charles Jones, who is the Chief Procurement Officer for Cook County Health. And we're really excited to hear more about the procurement process as it relates to doing business with Cook County Health and all of the great information that they're going to share. So I am going to go ahead and stop sharing my screen, Jacoby, and then you can go ahead and share your screen and get started if you like. And thank you for asking that question in the chat. Yes, I apologize. I did not explain that. So you will get a follow-up email with the recording to this. You'll get a link to our YouTube channel that has all of our recordings on site. And so you'll be able to access this particular training as well as any other trainings that we have. And if Jacoby and Charles are okay with it, we'll also share the slide deck with you. So you will get an email from me at the end of the day with all of those resources. So thank you for asking that question. Okay, Charles, we can see it. So I will mute myself. Jacoby.
Well, good afternoon, everyone. I'm Jacoby Rafford. I'm the Director of Supply Chain Management and Contracts here at Cook County. I guess, Charles, do you want to introduce yourself? If not, Charles Jones, he's our Chief Procurement Officer.
Yeah, I'll do that. Hey, good afternoon, everyone. Charles Jones, Chief Procurement Officer for Cook County Health. I thought I was along for the ride today, and just for support, this is Jacoby's rodeo, and I'm along for the ride, but I will answer some questions as necessary. You're in good hands with him. He's my Director of Contracts. Just a little bit about me very quickly. I'm the Chief Procurement Officer since 2017, though I've been with the health system since 2012. So good afternoon. All right, Jacoby.
All right. So really, we're going to kind of talk through some of the things that we do at Cook County Health and how we do business. If you're familiar with doing business with Cook County, we're somewhat similar, but we're different. And we'll get into a few slides that will kind of explain that here. So we'll get started. See. All right. Just to kind of give you a general overview. So with Cook County, the Cook County Hospital, we are one of the largest hospital health systems within the country here. We basically serve over 600,000 unique individuals on an annual basis. We operate the John Stroger Hospital, which is our primary flagship hospital unit here. We also operate the Provident Hospital, our ambulatory hospital and health centers, the Ruth M. Core Center. We also work with Cook County Department of Public Health that we operate, the Correctional Health Services. So, and also with County Care, our largest managed care program, Medicaid managed care plan in Cook County. So with that, mostly of our focus is really supporting the health system. And so we are purchasing things to keep the hospital and the health system operating pretty much 100% of its time here. And just want to double check to make sure everyone can hear me here as well. I've kind of
We can hear you. It might be just a little bit low, like if you can turn your volume up just a little bit, but we can definitely hear you.
go off camera for a second here as well to save some bandwidth. All right. So our office, the Office of Supply Chain Management, which supports the health system, our mission is to create a high-performing supply chain management procurement function. We are strategically sourcing goods and services across all spend groups, and we'll get a little more into the types of spend groups that we are working with, as well as effectively managing our suppliers and monitoring our contracts, as well as ever so searching for those cost savings with the purchases that we do throughout the health system. We are valued to support the system by our ICARE process, which is to innovate. We're providing innovation, compassion, accountability, respect, and excellence in delivering services. It's the model that we operate under, and a mission as part of working under Cook County Health. And just to kind of give an introduction more so what we do and how we differ from Cook County. Let's see, is this working? Okay. And with Cook County, what's different between us at Cook County Health and Cook County Cook County government is that supply chain management is responsible for procuring all the clinical and non-clinical commodities, equipment, services, supplies to maintain the operations throughout the health center. And as part of that, we are enabled under the ordinance 08035, which was formed in 2008. The Cook County's procurement policy is somewhat different from that we operate under versus the county government. And we also utilize and operate under the Cook County government as well, under the procurement code that's authorized under the county government. So to kind of summarize this and how we differ is that we at Cook County were able to procure goods and services under this enabling right. We have developed actual procurement policies that we operate under, which is similar to the county procurement code, as well as operate under those particular guidelines. And so some of the priorities that we focus on here at Cook County, at Cook County Health in supply chain management. Again, we are purchasing, clinical and non-clinical goods and services. We strive to obtain those goods and services for the patient at the lowest possible rate and lowest possible cost, while also operating and delivering and providing and selecting those equipments and services at a high standard using our ethical conduct to ensure timely and appropriate procurement of those supplies and materials. We also, as part of our process, communicate with you as part of the overall procurement process. We do a public process here where we ensure the fairness and to be transparent in the overall competition. We seek to guard against fraud with the types of contracts that we are purchasing and the services. So we do guard against those fraud and corruption types of things that could occur. And we're always looking to drive cost savings as part of the purchase and just save those our taxpayer dollars to support our particular patients and the county itself. So who do we support at Cook County? We support all the departments within the health system network. Again, our network is the Stroger Hospital, Provident Hospital, ambulatory, over a dozen ambulatory and community health clinics, including the core center, the Ruth M. Core Center, our Department of Public Health, and county care. So examples of those particular departments would be our Department of Radiology, surgery, of course, our Department of Facilities. Those are the types of similar departments that we would support during our operations. Any questions so far? Take a little check real quickly.
Hey, Jacoby, no question, but I'll chime in here too, Charles here. We also service the Cermak Health Services, which is all of the healthcare for the Cook County Jail with our detainees.
Thank you.
And along with that, the Juvenile Temporary Detention Center for our youth.
All right, so how do we procure these services? We procure using our competitive solicitation or non-competitive solicitation format here. Under our competitive solicitations and per our policy, we procure items and goods through our small procurement for purchases under $5,000. We also utilize the RFP process and RFQ process to receive qualifications. We are unique in a sense from the county, where we also use a value analysis committee, which evaluates certain medical equipment and certain medical services that would be introduced to the hospital and trialed. So we utilize that value analysis process. And under our non-competitive solicitation, we are members with Vizient, a group purchasing organization. So you also use the group purchasing and consortium processes, of course, through sole source, comparable government procurement, and as well as emergency and joint procurement. Again, we strive to conduct the procurement process in a competitive and open, fair environment. Everyone that's involved, especially in my department, as well as our user departments, we work with them to make sure that they are aware of the policies and procedures, and to ensure that we are providing fairness throughout the entire process. And as such as how we procure, I would like to give you an idea of some of the things that we procure to support the hospital. Again, we're one of the largest hospitals in the country. We provide all our clinical, non-clinical services, equipment, supplies. We're purchase things, examples would be CT units, OR lights, and surgical beds. Of course, surgical supplies, office supplies, janitorial supplies are some examples. And for services, anywhere from the non-emergency medical transportation, valet service, various financial services, as well as janitorial type of staffing services that we will also seek to purchase throughout the hospital system. And as such, one of the things that we've introduced here as we are in the process of also looking to improve some of our outreach, as well as communications to the vendor community, and as well as the marketplace. We are moving towards a paperless procurement system under Bonfire. Again, we are similar to Cook County, but in this case, we have a specific system that we're using. So with Bonfire, if you've seen this, the county government's procurement and doing business with the Cook County government, again, we are similar in this particular instance. With Bonfire, we are using this to solicit opportunities and provide those opportunities through our particular portal under Cook County Health. This is an opportunity to review solicitations, respond to those solicitations in a or web-based portal type format. You have the opportunity to view contract requirements and specifications. You can send questions through the system, as well as when you're ready to submit your proposals, you're able to submit those requirements and pricing directly into the system itself. In Bonfire, one of the things that we would like is that you register under the Cook County Health particular portal, so that when those opportunities do become available, you're notified based on your commodity codes and your vendor specifications at that point under your profile. Are there any questions?
Let me take a look. Malia or Andrea?
Hi, this is Malia.
Okay.
I think there's a few questions in the chat. One is, are there any procurement opportunities currently available for funeral service providers? And then the second was, can you give us an idea of the types of industry services, products that you typically need? I think that question was answered. It said, do you use immigration law for firms, for visas, for doctors, etc.?
All right.
So let's try to go with those one at a time. For funeral services, unfortunately, no. The only thing we do is, so we have a morgue on site at Stroger Hospital, and we're not in that particular business of needing funeral homes. So the families have to claim the deceased from our morgue. We do have something set up with the Chicago autopsy for some services, but no funeral homes. What's the other questions, Malia?
This is Andrea. There was a question about what were the other facilities included? Or are there other facilities included, like Cook County, Providence?
Yeah, so we have, go ahead, Jacoby.
Yeah, I was going to say that our system, the hospital system, consists of the Stroger Hospital, Providence Hospital, the Cermak centers, health services, the Cook County Public Health, our ambulatory network clinics. So there are over 12 clinics throughout Cook County, as well as the Ruth M. Core Center, and then of course our county care, which is our managed health managed care program. Within each of the units here, we have multiple departments. The examples were as an example, we have environmental services, which is our janitorial support team. We have facilities and services, as well as buildings and grounds. From the medical side and clinical side, we have our surgical units, cardiology units, radiology units, ophthalmology units that we work with. And as well as on the patient-facing side, the patient supports divisions and units in the hospital. And of course, they are spread, those types of departments are spread across each of the operating units within the health system. So I hope that answered the question.
Okay, this is Andrea again. Debbie Waddell had a question. When will the county health system bids open up?
not certain of that question. But we'll talk through a little bit more about the opportunities on some of what we are currently advertising and what's currently what's upcoming. Talk a little bit more about that couple more slides.
As part of that, we have advertisement always up on our website. So Jacoby, maybe at some point too, if you don't have it in the slides, talk about how that process works.
Yeah, those are in some upcoming slides.
Okay, we can just go ahead and go through the slides and
Yeah.
hold the questions until later then.
Yeah. And so as we talk more about Bonfire, all right. So Bonfire, I want to say this, if you're, and I have to say it like this, if you're familiar with the county government side, we are on the Cook County Health side, we are just beginning to use Bonfire. We became active with Bonfire about 8 months ago, sometime around October, November of last year. We just began using the system. So we are in the process of, from my staff, learning to use the system and getting used to how we are, effectively communicating those opportunities to those vendors within our particular umbrella of the Bonfire network. So, one of the things, if you haven't registered, I'm sure, if you've registered with Cook County, we would encourage you to also include Cook County Health to your profile so that you're notified of any sort of opportunities that become available. We'll share the link with you as well so that you'll see that we do have a separate account and URL account address that's different. And so once you've registered and logged into the system, you have an opportunity to view current opportunities. So any of those current opportunities, you're welcome to review those and research them to see if there's any opportunities that you can work or provide services. As part of the system itself, the system allows you to ask questions. So a lot of the question open period is a good time to notify us of those particular concerns and questions related to a specification. And then we on our side have an opportunity to respond to those type of questions. From in certain RFP or proposals, or requests for proposals that we issue, we do conduct pre-proposal and pre-submittal conferences. This again allows you to learn more about what we are trying to purchase and allow you to ask questions about those RFP documents. And also there you get a chance to submit your response. Another key with partnering with us, we do, within our RFP documents, we identify the requirements that the particular request is for and what we're looking to purchase. We typically include a background and an objective of what the overall outcomes would be with those related RFQs and RFPs. If there's additional questions or additional information that's required, that type of information is outlined in the RFP. So if you happen to log into one of the responses and see an opportunity, there may be additional attachments that you would have to address. So you just kind of be mindful of all the different resources and attachments that would be associated with a response. As part of the response, we are also obligated and required to meet the MWBE utilizations requirements under Cook County Procurement Code. So with each of our solicitations, there is an opportunity for companies to submit their utilization plan to explain how they will meet those participation goals. And we're similar in the county where we meet those, the typical participation goals are either the aspirational 10% or 35% minority MWBE, so minority women business participation goal for professional types of solicitations. You have an opportunity to submit your pricing as well as the overall response to how you provide your services. And with each of our contracts and with our RFPs, we do ask that the economic disclosure statements are included with your responses, as well as any additional requirements that may be specifically asked in that particular RFP. So some general information on contacting us and being aware of how to access those particular bids. Our website is cookcountyhealth.org. You can find specific information from about our department under doing business with Cook County Health. And you can access that by clicking the About Us link, and under that About Us tab will direct you to the Doing Business with Cook County Health. You can also view the current opportunities that we have within under Cook County Health directly with Bonfire. That's cookcountyhealth.bonfirehub.com. You'll be able to see the current opportunities as well. I mentioned before, we are required to maintain participation with the Cook County Procurement Code for Minority and Women-Owned Business Participation. And we encourage that throughout all of our bid processes and proposals and contracts. So we encourage that, and particularly we encourage that with contracts that are valued over $25,000. And particularly minority firms that we accept, and as with the county, we accept these certifications from firms that have been certified by Cook County or the City of Chicago. Our next slide is kind of just give you a quick overview of what's currently opened in our network. We do have three current proposals that are, three current requests for proposals that are currently opened. Those are for plumbing maintenance services with to support our ACH in our our ambulatory and community health network clinics, as well as an HVAC type of repair service that's associated as well for those clinics. And we do have a nurse operations and patient throughput RFP requests that will utilize artificial intelligence. Those are three of the current opportunities, and we do have a few that are in the pipeline that are soon to be released here. And to give you an example of some of the upcoming opportunities, we have a valley service for our target market vendors, patient education screens, a snow removal, security staffing, as well as a couple of financial service related types of opportunities that are upcoming. This is just a sample list, so we can provide a more current list under our buying plan. We'll communicate that with Dr. Butler as well. And to sort of wrap up here, with if there's any information that you would like from us, you can contact us by email at purchasing@cookcountyhhs.org, or our website under for more information at cookcountyhealth.org. You can also give us a call here at 312-864-4800. I just realized that number is the general number, but we can give you a direct number to our particular office, so that if there are any questions, we can get those answered for you. So with that, I can kind of wrap it up here. Move into questions.
This is Andrea. There was a question by Brittany Reynolds. Are there any procurement opportunities available for non-medical home care agencies?
Charles, if you want to take that.
Yeah, since we are in the business of Medicare and dealing with medical and the hospital and health system, I would have to say no right off the bat. We do have home care type stuff for the area of managed care with some patients, follow up and stuff, but that's medical as well. Individuals have to be certified with nursing and doing home health, home care. I think some of that too goes through our county care health plan services with follow up, but in short though, no for non-medical. That's not our space.
Okay, let's see if we, Thank you, Andrea and Malia, for your assistance. I'm trying to pull out some questions in here that might be able to get answers now, because I think some of the questions in here, they would have to reach out directly to you all or to someone else, because some of the questions are pretty specific. Let me see.
Yeah, while you're doing that, Dr. Butler, I did see something pop up about bids for small business. And whereas we don't specifically target straight small business, we do do target markets for vendors that are certified with the County of Cook and the City of Chicago as minority and women-owned business. So as you saw in the RFP there with the Valley Service, we're doing a target market. And just recently we did things for task orders that we went out to a target market. So when I say target, it just means all minority certified vendors.
Thank you for clarifying that, because I was going to actually clarify target market for them.
Yeah.
Thomas Richards, can you come off of mute and ask your question? I know you were asking about a listing, but I'm not sure what you were talking about. So feel free to come off of mute real quick and ask them your question. Is Mr. Richards still on? Maybe he's not.
I'm here. Can you hear me?
Yes, I hear you now.
Great. My question was floor care products. What's your timeline for acquisition of floor care products for facilities, stripping, burnishing, that kind of thing?
Was that on the list, Jacoby? Because we generally, we don't outsource that. We have our own employees in-house that work with our environment services department, and they are our unionized labor employees that handles that business in-house.
Well, we're thinking of two different things. I'm thinking of the actual product. We provide the products, as we did in the 90s and early 2000s before you changed your acquisition process. So now I'm wondering, when it's time to clean those floors at the healthcare facilities, how do you obtain those products for stripping the floors, buffing the floors, polishing the floors? That's my question.
Yeah, so they're probably, some of them may be medical grade products, and I would think that, those goods and services are procured through our purchasing consortium, which is our GPO with Vizient. Any vendors and stuff there are members. So with the fact that we have enough members on board with that, we don't go out necessarily for an RFP or competitive bid for that. But then after we were about to do a contract, we work with the Office of Contract Compliance to get a contract specific goal for those GPO contracts. And if vendors such as yourself are registered and certified, with the county, then those GPO vendors are required to partner with you for utilization of those contracts.
Thank you. Thank you, Charles. So looking at some of the other questions, Jacoby, will you be sending me the link to the buying plan so I could add that in the follow-up email?
Yes.
Okay, because to some of the people in here who are asking, some of the attendees who are asking about like specific opportunities when they're going to come about, that buying plan will really be able to communicate that, because the buying plan, if I'm correct, is kind of giving them information for what's coming down the pipe, or what opportunities or what procurement opportunities may be coming available. So I'll make sure that once Jacoby sends me that, I'll make sure that that is added into the follow-up email to all of the attendees and the registrants. Also, bonfire. Can we get the bonfire link in the chat, or maybe it was already put in there? I don't know. I'm reading one of the questions.
Malia posted it. I think she posted it. Yeah.
Okay.
Yes, I put the link. I put the link in there in the chat.
No problem. And Malia, if you can send that to me in email, I'll also add that into the follow-up email too. So they'll have that. Thank you. Looking again. The direct number. Jacoby, I think you mentioned something about the direct number that you would give them.
Mm-hmm.
Someone is asking for that direct number for questions.
Yeah, I'll send that to you so that you'll have that as well when it goes out with the communication.
Okay, gotcha. All right, I'm looking. A lot of people are asking about janitorial supplies.
Yeah.
Any opportunities for office or janitorial supplies? Y'all have anything to add to that, Charles or Jacoby?
Yeah, that goes back to my my statement earlier about the GPO vendors, and
Okay.
if need be, and if they're certified, and if there's goals on it, then we'll look to partner with.
Okay. Yep, got it. Thank you. Someone's asking about technology support services aren't listed. Is that something that is technical IT support services, something that the hospital procures for?
Yes.
Generally? Okay.
Non-emergency medical transportation.
Yes, we have contracts in place now with non-emergency medical transportations, both on the hospital side, the health system, hospital side of the house, and with our county care health plan services. Those I know those vendors does have participation with minority type business there with the goals. So, but I do believe, I think I was scrolling through the chat, and I believe that question was asking, the vendors are BEP, right? So business enterprise certification for the state at the moment, and maybe Dr. Butler and Malia, you guys can speak to that. We don't get credit for BEP. Doesn't mean you can't do business and all, but we don't get certification.
Right. No. Yeah, that's just state. BEP is state level, so we don't have a reciprocity agreement or any type of agreement with the state of Illinois. So Deidre asked, what is the appropriate method to follow up on an RFP to secure a status of the process?
It's currently in the bonfire timeline. So under a specific project, there is a timeline that's associated, that's linked to that particular project. So that gives an overview and status on where things are during the process of that solicitation.
Okay, so when everyone registers with Bonfire, I also think a lot of these questions will be answered because they'll also be able to see like RFPs and procurement and stuff like that. And I think so. This person sent this directly to me by accident, but he asked, does CCH have a window where they entertain bringing on new staffing agencies for administrative positions or medical positions?
So we just posted a solicitation for that within the last month or so, and it's down with going through the evaluation process. So I'm assuming individuals that's on this call probably missed that opportunity or wasn't registered and did not know about it, because we got it's still open, so there's not much I can say about it, but we did get robust responses back with almost up to 19-20 vendors.
Okay. And then Tina asked, Tina asked, do you do business with non-certified companies or is certification mandatory? I know how we are with the government, but I don't know if anything's different. I don't imagine it's different with you all, but I'll let Mr.
Yeah, so we do business with all companies. It's just that, when it comes to minority and women-owned business or disadvantaged business and stuff, if you're not certified with the county or the city, then we don't get credit for your participation if you are a small business or a minority business. But opportunities is open for any and all vendors if you have a product, a service, or a good that we'll need for operations and caring for our patients.
Thank you.
Christina,
go ahead.
this is Andrea.
Andrea, sorry. Can you ask the question that Christina asked? That's a good question.
I'm sorry.
You see it?
No, Ann Hughes, I was about to read a question that Ann Hughes had. Who do I talk to about IT disposals, including hard drives and data destruction?
So our CIO is Chief Information Officer is a young lady by the name of Angela O'Banion. But Jacoby and I can provide her information to you in the follow-up.
Okay. Christina asked, what is the threshold for a bid to go out as public notice for CCH? What is the process of becoming a preferred vendor for non-competitive bids or for no bids?
You want to handle that one, Jacoby, or you like?
You start and I'll jump in.
Yeah. So as you saw in the information, ordinance and policy considers a contract or at $25,000 and up. That's where we do the count for the minority business. So we'll start at least in that range of 25,000 and up. There's sometimes that there may be something that's slightly over there that we'll end up, doing a contract for and having participation, but we may not necessarily go out for a public RFP or competitive bid. We may do, request for quotations from a target market or something like that. But I would say that the threshold is probably 25,000.
Okay. Andrew, you got a question to ask? Oh, Jacoby, I'm sorry.
Yeah. And then as for the other non-solicitation or non-competitive, which we utilize our group purchasing organization, we are members under Vizient, and typically the companies that we can purchase from under and get credit from the Vizient organization, Vizient issues under their particular umbrella. They issue solicitations for services and equipment and supplies as well. And because they are issuing those as a competitive process, and under our membership in that organization, we are able to request quotes from those particular companies that we have been authorized to utilize. As for the comparable government procurement, we are working with and seeking out contracts that have been awarded through a competitive process through other agencies, whether it's Cook County or the city of Chicago, or even the state. We utilize that particular format or method to enter into contracts as well, using those particular non-competitive methods.
Thanks, Jacoby. I do have a question myself, maybe that might help someone in here also. Do you all make the contracts available to the public, like once they've been awarded? So for instance, Asha, I hope I'm saying her name correctly, asked, once we respond to a bid, do we get feedback if we are not selected for it? So to extend to that question, I was also asking, once you award a contract, do you make the contract available to the public so they can see kind of information that's related to the contract, kind of see maybe where they went wrong or something like that?
Yeah, I'll answer that. So first and foremost, yeah, we do send out letters of notification to vendors that they were not selected as part of the process. You know, once we've selected and made the announcement for an award and is ready to take it to the board, then we let the other vendors know that through letter that they were not selected. As far as the contracts themselves, right now we do not publish everything out on a site like the county or the city does. Reason being is, again, then with healthcare, there's a lot of confidential information there. So our preference is that anybody that wants a contract will go through the FOIA process, the Normal Freedom of Information Act process, to solicit the contract. And then it's our legal department at that point redacts whatever confidential information there is when they send it out.
Makiba, I asked that question. Do you mind if I have a follow-up question on that?
Go ahead.
Thank you. So Charles, would we get this, would we get information on how we scored once we make a proposal? Just so that we can fine tune it the next time around we submit our proposal.
So you can, once you've gotten the letter, I'm sorry, I got this meeting notice popping up. Once you've gotten a letter that you haven't and that you didn't win, and we've made the award and we've actually got that contract signed, sealed, delivered, and close out that RFP, then I'd say yes. Feel free to reach out to my department, either myself and or Jacoby and our team, and we can talk to you about certain things and walk you through the process of some lessons learned.
Perfect. Thank you so much.
You're welcome.
And I'm just going to propose a couple more questions. We only have like maybe 3 or 4 anyway in the chat. What are your payment terms for service for products and professional services?
Net 25, net 45, I'm sorry, is our preference. However, I make no bones about it since I've been in this position that you're dealing with the county and the government entity and stuff. So it's net 45, hopefully and prayerful that happens.
Okay. Do you allow subcontractors or are all your bids direct?
Let's see. No, so yeah, so any and everybody can respond to an RFP as the prime, right? So and our preference a lot of times too, as we try to grow our participation with minority vendors, is that you do respond as a prime. However, if you do not have the ability to, get a contract as a prime, then you can look to partner with some of the other folks that's that has that's listed there, for the RFPs, and then maybe come in as a subcontractor. Jacoby, were you about to add something to that?
Yeah, that's say something similar that, yeah, we are open to all with that, that meets all the qualifications to provide the need. As subcontracting, meeting those requirements under if there's a participation goal there.
Okay. For all solicitations under 25,000, how do you become a vendor? Or how do you get on the list for RFQ or CCH?
Now it's registered through Bonfire. It's best avenue at this moment.
Okay. Okay, so I should, he's gonna send me the direct number and I will put it in the follow-up email. He has to get it. So the follow-up email may or may not go out by the end of the day, depending on when I'm able to get that information. And I have a meeting at 3. So we may not get it out by the end of the day, but I'll definitely make sure that if it's not out by the end of the day, that you all get it mid-morning tomorrow, the follow-up email. You're welcome. And then the last question that I see, I am piggybacking on the contracts that you currently have with vendors for your non-emergency transport. When does the new contract go out for bid?
I'm not sure. I think we just did that within the last year or two. And so when we normally let those type contracts, they are initially for 36 months with 1 or 2 renewal options there that take us about 5 years. So I think we're a few years out.
All right. Well, I don't think I see any other questions. So thank you all. I really appreciate this. This is a lot of information, and I'm hopeful that it was very valuable to those who attended, took the time out to attend. I appreciate that. Jacoby will get me all of the collaterals that he has, and I will, as mentioned, make sure that I send them in the email. I'm also going to send the recording of this meeting. Actually, I'll send the YouTube channel link, and then you can navigate that to see what trainings you want to look at. This will be the first one, the most recently uploaded. And then anything else that we have going on, I'll definitely make sure to include that as well. So thank you, Jacoby. Thank you, Charles. I really appreciate your time for this.
Dr. Butler, there's a question. Kathy E. wants to know, are we getting the slides?
Yes.
Presentation, okay.
Yes. Thank you, Andrea.
Yeah, so thank you, Dr. Butler, for putting this on, and Malia and Andrea, and as well all the vendors and everybody that participated today. Thank you, because we do look for your help as we look to grow our participation and our use of minority and women-owned businesses and small businesses within Cook County.
Yes.
Yeah. Thank you.
Thank you so much. And maybe who knows, I might be able to convince them to let's do something like this on a quarterly basis. If not a quarterly basis, maybe a couple times a year, because I know it's a lot, but I do believe that people are really interested in learning this process even more. So this may not be the last time we come before you all, but thank you again. And please be looking out for that email from me no later than tomorrow mid-morning. Have a good day, guys.
All right. Thank you.
Thanks, everyone.
Thanks.